Hi, I'm Chloe, and I'm a specialist diabetes dietitian for the West Hampshire Community Diabetes Service. We know that dietary advice when you are living with diabetes can be really confusing, particularly when looking at social media or the internet. So I'm going to discuss the pros and cons of some of the main diets in type 2 diabetes. And we will also take a look at some of the things that you should consider when choosing which diet approach is right for you. The word diet can imply short-term changes, and while some of the diets I will talk about are short-term, overall it is important to make long-term dietary changes as well as lifestyle to help manage your diabetes. The main diets we are going to talk about today are the very low-calorie diet, a low-carbohydrate diet, and the Mediterranean-style diet. A very low-calorie diet is normally a 12-week, 800-calorie-a-day diet. Most people will follow this using meal replacement shakes or soups, but some people may make up the 800 calories with food instead. Following this, you will gradually reintroduce food and may choose to follow one of the approaches that we will discuss later. This diet is based on research done as part of the DIRECT trial. The participants had all been living with diabetes for less than 6 years, and we know that the closer to diagnosis that you start this diet, the more likely you are to put your diabetes into remission. However, if you do not put your diabetes into remission, there are other many benefits, such as reducing your HbA1c, coming off some of your diabetes medications, and other health benefits that are associated with weight loss. This diet is good if you like something that's very prescriptive and that requires little preparation. It's also a very cheap diet to follow. However, although the principles are simple, you may be having very limited food intake for 12 weeks, and so you need to be very motivated and also consider the impact that this may have on both your social life and also your mental health. There are also some side effects which are most likely in the first couple of weeks and will tend to improve after this. As the diet causes rapid weight loss, you will be at risk of something called gallstones. This diet can require some medication changes prior to starting, so it is important that you speak to your GP or practice nurse before starting the diet and ask to be referred to a registered dietitian. A low-carbohydrate diet is another diet which can lead to remission of type 2 diabetes, although this is generally only for as long as you're following the diet. If you return to your old eating habits, it is likely that your diabetes will return. It can be used as an approach to help with weight loss and reduce blood glucose levels, or even both. A low-carbohydrate diet involves reducing your carbohydrate intake to 50 to 130 grams a day. There is no evidence to support following a very low carbohydrate or keto diet where intake is less than 50 grams of carbohydrate per day. This diet is less restrictive than the very low calorie diet, so it can be much easier to fit in with things like family meals. However, it does require more preparation and planning, and so you do need to be careful with what you replace the carbohydrates with to avoid weight gain or even increasing your cholesterol levels. This diet can require some medication changes prior to starting, so it is important that you speak to your GP or practice nurse before starting the diet and ask to be referred to a registered dietitian. The Mediterranean-style diet is similar to the principles of the Eat Well guide. It encourages intake of many fruits and vegetables, beans, pulses, whole grains, nuts, oily fish, and unsaturated fats. It is characterised by a lower intake of meat and dairy foods. It is important to pay attention to portion sizes when following this diet, so you can refer to one of our other videos to further guide on portion size control. It is less restrictive than the other diets and can lead to weight loss, but is less likely to lead to remission. This diet is good for encouraging longer-term sustainable dietary changes, and it also has many cardioprotective benefits, so may be particularly good if you have had a previous heart attack or stroke. Some people find that this diet can leave too much open to interpretation, making it harder to follow and meaning it requires more planning. So, those were the main evidence-based diets for those living with diabetes, but you may have come across lots of others. Diets which encourage you to cut out whole food groups or have a particularly high intake of certain food groups are unlikely to be nutritionally balanced. If diets significantly change your carbohydrate intake, so these would include foods such as pasta, rice, potatoes, bread, cereals, and even fruit, or involve periods of fasting, then this will all have an impact on your blood glucose levels. So as I've previously mentioned, please do speak to your GP or practice nurse in case you need to make any changes to your diabetes medication, or if you would like further guidance about diet and diabetes. You can also take a look at the following websites for further information.